As an agent or broker, you have an important role in connecting consumers with marketplace health insurance coverage. When the continuous enrollment condition of the Family's First Coronavirus Response Act, or FFCRA, expires, agents and brokers will have the opportunity to help even more consumers obtain coverage from the marketplace. This video will help you understand what will happen when the continuous enrollment condition of the FFCRA expires and how it will affect consumers who are enrolled in coverage through Medicaid or the Children's Health Insurance Program, also known as CHIP. Since the start of the COVID-19 public health emergency, PHE, additional federal funding has been available to states to help millions of individuals maintain Medicaid coverage. To receive these funds, states were required to accept the continuous enrollment condition of the FFCRA and keep nearly all people enrolled in Medicaid until the continuous enrollment condition expired. Many states also implemented similar policies in CHIP to promote continuity of coverage. States will resume normal Medicaid and CHIP eligibility and enrollment practices on April 1, 2023, and will have 12 to 14 months, referred to as the unwinding period, to determine if individuals currently enrolled are still eligible for these programs. This process will be the single largest health coverage transition event since the first open enrollment period of the Affordable Care Act, with an estimated 15 million people at risk of losing their current Medicaid or CHIP coverage. The unwinding period is an important opportunity to demonstrate the critical services you provide to your community and to grow your book of business beyond open enrollment. You play an essential role in connecting these consumers with coverage, and one of the keys to your success during this period will be reaching these new consumers. Because of this, you should consider developing a marketing, outreach, and staffing strategy centered around these new consumer communities now in order to reach them effectively. Consumers losing Medicaid or CHIP coverage during the unwinding period may face a confusing process, and you should make sure you or your agency are ready to help with staffing and outreach to support these consumers. Some consumers will be eligible for marketplace coverage and the expanded savings that are now available for high-quality coverage. Consumers who lose Medicaid or CHIP coverage between March 31, 2023 and July 31, 2024 will be eligible for a special enrollment period, or SEP, beginning the day they submit or update a marketplace application. Consumers will receive the Unwinding SEP automatically based on their answers to application questions. Those who are eligible for the Unwinding SEP will have 60 days after they submit their application to select a marketplace plan with coverage that starts the first day of the month after they select a plan. For consumers who attest to a loss of Medicaid or CHIP coverage in the past, marketplace coverage will start the first of the month following plan selection. For consumers who attest to a future loss of Medicaid or CHIP coverage, marketplace coverage will start the first day of the month after their last day of Medicaid or CHIP coverage. To assist consumers eligible for this SEP, you should help them. 1. Submit a new application or update an existing application and answer yes to the application question asking if their Medicaid or CHIP coverage ended recently or will end soon. And 2. Attest to a last date of Medicaid or CHIP coverage between March 31, 2023 and July 31, 2024. CMS will share additional resources to help you find and assist these consumers through its normal agent or broker communication channels. Even if a consumer isn't eligible for marketplace coverage, agents and brokers can be important resources to help them access coverage. A first step that you can take to assist both new and returning consumers is to remind them to update their contact information with their state Medicaid or CHIP agency if they are currently enrolled in Medicaid or CHIP. This will ensure that consumers receive important and timely information from their state Medicaid or CHIP agency leading up to and during the unwinding period. For more information about your state's unwinding processes and where consumers can go to update their contact information, please visit the medicaid.gov/renewals link in the description. During the unwinding period, some individuals who lose Medicaid or CHIP coverage and apply for marketplace coverage may be referred back to their state Medicaid or CHIP agency. You should direct these individuals to review the results and next steps in their marketplace eligibility determination notice, as they may be eligible or potentially eligible for Medicaid or CHIP even though they recently lost that coverage. You can also guide them to other assister organizations such as navigators that can provide further help. A satisfied consumer can always lead to new business in the future if their circumstances change or by providing a referral. To help you and others prepare for the unwinding period, CMS launched a new webpage that serves as a one-stop shop for resources and tools. To view these resources and updates, visit medicaid.gov/unwinding, which is also linked in the description. Along with this CMS webpage, many states are creating websites that lay out their plans. We recommend agents and brokers review states' websites in areas where they assist consumers with marketplace coverage. As a reminder, ensure that you have the correct contact information listed in Find Local Help and that you are registered for Help on Demand. These programs will help you reach and assist new consumers during the unwinding period. For more information on these two programs and how to update your public profile within the Marketplace Learning Management System, check the video description below. CMS values your contributions to the marketplace and is here to support you throughout the unwinding period. To access any of the resources mentioned in this video, check the video description below.